I think individuals with hearing loss are ultimately trying to reduce the barrier or break down the barrier that a hearing loss can impose on their ability to effectively communicate. And ultimately that goal is communication. My name is Dr. Emily Patterson. I'm the audiologist here at Southwest Health Center. I think people are afraid to seek help with hearing loss, or maybe don't seek help with hearing loss because it often happens very gradually over a period of time. Most people don't wake up one morning and all of a sudden have a hearing loss. It typically happens little by little over a period of many years, and people adapt and adjust to it, and so they often don't realize the problem that they're having, and they don't know what they're missing. And I think a lot of times people, unless they have a friend or a family member mention it to them or kind of push them to come in and get evaluated, they don't really even realize there's much of a problem. I think a lot of people maybe suspect that they have a hearing loss but are reluctant to come in because they're afraid of hearing aids, or they have a certain level of anxiety about hearing aids. Oftentimes it's because of an experience that they heard somebody else have, maybe a negative experience. And that is real and out there. There are a lot of solutions though, and new technology that's available that has really eliminated a lot of those common frustrations with hearing aids. And the other part of it is there is a risk-free trial, or a trial period with hearing aids that allows you to see if they benefit you without suffering any of the negative consequences of maybe paying for something that you think you're not going to use or is not going to work for you. People's expectation for how to treat a hearing loss is different depending on what their hearing loss looks like. Some people that have a mild or minimal hearing loss may have trouble hearing some talkers, or hearing and understanding speech in certain situations. There are solutions for those patients. Other patients might have more of a severe, profound hearing loss, in which case they have the added difficulty of maybe hearing alerting signals, or for safety purposes need solutions that will meet their needs. So the goal, or the take home, is that there are solutions out there for everybody, regardless of what their situation is or what their hearing loss looks like. If an individual suspects that they might have a hearing loss, or is interested in finding out more information about the function of their auditory system, they can first talk to their primary care doctor, maybe go in for a routine visit, have them check their ears to see if possibly wax needs to be removed, and then the physician can talk to you about some of the difficulties that you're having and refer you for a hearing evaluation.